Last month, Medicaid cuts began with the passing of the One Big Beautiful Bill Act. I'm Michaela Chavez, your Sunrise neighborhood news reporter on the South Side. Now, one mom is speaking out, sharing her own experience with Medicaid, her concerns about the cuts, and sharing helpful resources for those who may be impacted. Melanie Sandoval is a mom of 3 and a full-spectrum doula. During her 3rd pregnancy, a persistent headache changed everything.
They ended up checking me for everything, and they found a brain tumor.
Medicaid covered her treatment, but a year after giving birth, that coverage ended. Because of her pre-existing condition, requalifying wasn't an option.
I would have to do an out-of-pocket pay. Obviously, that would be thousands of dollars a month.
The new law states most adults between the ages of 19 and 64 will have to work, volunteer, or attend school at least 80 hours a month to keep their Medicaid coverage. For some, balancing a family, a job, and more can be challenging.
Single mothers, it feels like we're being excluded. I'm saying we are because I am a single mother.
She says middle-class families will be hit the hardest.
We're already spending thousands of dollars on groceries. Our rents have gone up. On top of that, we now have to worry about health care.
While these won't take effect for another few years, Sandoval is thinking ahead, worrying about the next generation, including her own daughters.
They're 7 and 6 years old, so by then they're going to be in their teens, in their reproductive age. And so it's really important that we start acknowledging what is happening and figure out how, as a community, we're going to come together to fill those gaps.
That's why local nonprofits are helping to bridge those gaps.
I feel like we've always had this mentality of, if they're not going to do it, then we're going to do it. So we have a lot of providers that are willing to work with people in payment plans. Some are even offering services for free.
They're offering prenatal to postpartum care. And here's a list of them. As for Sandoval, her organization will cover birth and postpartum doula services, childbirth education, and nanny services. She'll also have a diaper bank.
I didn't have any money, and I had 1 diaper left, and I had to figure it out. That's why the nonprofit exists, because I know what it's like to be missed, to fall through the cracks.
And these services are open to everyone, and many are bilingual, helping families get the care and support they need. Melanie Sandoval encourages everyone to keep the conversation going and get involved. Want to help out with her organization? Click on christv.com to find out how. On the South Side, I'm your Sunrise neighborhood news reporter Michaela Chavez, Chris Sunrise.